Okay, good afternoon. So everybody's back from their lunch, so sleepy, but we had a good talk from Dr. Sharif about uh, our mental health and the heart. So I think we have started now going towards the wellness. So I know we have very respected and high-fi psychologists, psychiatrists. So it's nothing near the psychology and psychiatrists. I'm obstetrician and gynecologist, and I have been with the women for the last 40 years. So I was very active surgeon, radical treatments, and then giving a lot of medicines and trying to make the women better. But in the last 5 years, I realized the medicines and surgeries are not the end of the diseases, it's the prevention. And that's why my interest now is reverted back to the wellness. Wellness is a very, looks like simple word, but nobody has so far understood it completely. I'm also trying to understand what is wellness. Because when you open the Instagram, 80% Instagram is full of life coaches and health and this supplement and that supplement. So it's all marketing and business. But actually, after COVID-19, everybody has diverted their attention to the wellness, and we are still learning. So, first time I'm talking about the mental health movement. So, excuse me if I do any mistake. So, let's talk about the women mental health. And really, I did a bit research that what is the difference between men and women brain. So, let's see what I can show you. So, 1 in 5 women, which is really big number, have common mental health issues. And by common, I mean anxiety, depression, and all those sort of things. And surprisingly, women are more likely to have mental health issues than men, although I have seen the severity of the mental disease in men. But I think because they become an over disease and they present more, and women are mostly suffering in silence. Okay, but one thing is that I know the mental illness is genetic and environmental, but in women, most of the time it's the social issues because more women is very much affected by the social issues. Although we say okay, men and women are equal, but women is weak socially. On top of it, she has a natural duty of being carer as a mother, as a wife, sister, and the jobs like midwife, nursing, they causes more stress, anxiety. Sometimes they are in isolation. They can't share their problems with the other. And obviously, when they are juggling too many balls, exhaustion. And then being a female, physically, she's also weak and they can suffer from physical and sexual violences. And obviously, she's at more risk of PTSD. I have put this as a predisposing factor because it's a global factor. Whenever there are wars and whenever there are refugees, whenever there are displacement, women and children are affected more. And nobody has given attention to them, what's happening to these places where wars are ongoing and displacements are happening. People are also only counting the dead bodies, but not the live women and children. And I don't know, I got this figure for somewhere, but I think it depends from region to region. But globally, the figure is 20% women experience rape or attempted rape at some point in their life, living the trauma for all their life and juggling with the mental issues. So, in a nutshell, women are more likely to develop PTSD. So this is an interesting figure, diagram I really wanted to present to you. She's more likely to attempt suicide more than men and suffers from anorexia and bulimia 3 times more than men because of body shame. 1 in 12 women will develop alcohol dependence during their lives. This was also surprising for me, but I think it's more common where in old age they have to live alone. It's like it's the problem of the West, but I don't know any figures from the East. But obviously, when woman is alone and she's living without husband or children, she become dependent on something. So 2 times they are more likely to develop depression. 2 times they suffer more from anxiety and other disorders, and obviously post-traumatic stress disorder double than the men. So this made me really interested to see is the man and woman brain are different. I usually do a lot of scans, and when I'm doing a scan of a 10-week baby, they ask me, what is the gender? What is the gender? I say, I can't tell you because gender is not differentiated. But it's my observation for the last 40 years that baby boys have bigger heads than the BPD is bigger than the girls. And so I just told them, okay, I'll give you a little hint, and this may be a boy, and 80% it's right. And this is an interesting figure. And I saw what's the neural connection. And when the neural connection is from frontal to the back, from front to the back, and obviously I'll explain you why. And the women you can see they're going from left to right, so that's why they are multitasking. They are more emotional, and their intuitions are high. And the men are more perceptive, coordinated, and their coordinated movements and all those sort of functions. And that's why they are good drivers. They are good cooks, chefs, they're good barbers. And for women, the job nursing, teachers, but women sometimes supersede the men. So, as I told you, that psychological problem, it could be because the brain, the neural connection, the size, the cortex of the female brain is thicker than the male brain, and it's just the repetition. Just want to mention, I know the mental problem, 20% are genetic, but 80% is really environment. So whatever environment she's exposed, whatever the problem she's facing, how the society is treating her, this is the way she behaves. So that's why a lot of women suffer from depression depending on from which region they are. And the depressive disorder accounts 40% disability in the woman versus 30% disability in men. And anxiety, I think anxiety is a common behavior, but I think it's related to the hormones also. So as women has low testosterone and men has high testosterone, and their supply is constant, and women supply up and down, so she suffers more from anxiety. So because my topic is mental health and beyond, so other journal health issues also contribute to the mental problems. So women, for the difficult and most challenging time for women is the perinatal issues. I can't see my screen. So perinatal, I mean, if an average woman is delivering 3 babies and then you contribute that time, it's a long time in the life, and the hormones of the pregnancy, and then they're going down, and then they are the way she delivers, and the period after that, and the breastfeeding period. It's a big challenge for the mental health of the woman. So although if she hasn't got any organic problem, this ups and downs in the hormones and effect on the brain, she's already exposed to this risk. Menopause is again a challenging time, which we thought that HRT will help us, but HRT hasn't proven very promising. And again, we are now advising women for their the wellness. So the new buzzword is wellness. So as I told you, the women are emotionally fragile than men due to the hormone fluctuation, pregnancy, parturition, menopause, and this alteration in their endocrinology and the constant change in the physiology of the nervous system determines their vulnerability. This is very interesting uh, diagram, and I took it from a wellness site. And this relates the women health. She's in the center with the changing of the moon and the changing in her mood and the changing in her menstrual cycle. So if you see the moon, when moon is new and dark, there's a darkness, and same is the darkness in women life, because this is the time when she's having her periods. This is the time for her to retrieve, to rest, to nurture herself. But this woman who's working with the man, she doesn't get that time to carry on. And then is the second cycle, which is pre-ovulation. Pre-ovulation is 7 days, 7 days period, 7 days pre-ovulation, and this is the time suddenly she feels new, because see, the moon is waxing, and with the waxing of the moon, woman is arising. So she is full of energy. She's dynamic. She starts writing what to do the list, and she makes a lot of plans. This is the best time of the woman. And then from day 15 to 21 is the ovulation. And she's really taking care of other people. She's confident. She's nurturing. She's celebrating. And this is the best time. And after, it's only lasts for 1 week. And then after 1 week, again, premenstrual time comes, and then this is the time when I have seen women struggling a lot and coming to the for the medical help, and why sometimes they suffers a lot. And I think this is the progesterone dominant phase. Progesterone is a killer for the woman brain. Estrogen phase is good, so progesterone, and they suffer a lot. But after explaining them and telling them it's not your fault, you listen to your body, and this is the time she has no endurance. She should not run marathon at this time. And she feels helpless. The task which was so easy for her had suddenly become difficult. She's withdrawn. So this is the time she should take the life easy. And this is very interesting. And then, there are alternative health and all this oil, that oil. That's not a scope of my practice, but this is very interesting. So we need to look into different factors one by one. We need to see what's happening in women's life. We need to see how many changes are happening, in her body, with her psychology, with her brain. And the only thing we can help her with the surrounding. Either she has to make sure that her environment is good and she's good taking care of herself, or somebody else to. So it's just the repetition that the menstrual cycle environmental I'll skip this. So other interesting thing is younger age group suffers more, and I really feel that girl from the age of 10 to 15, 16 is very vulnerable. This is the time she needs the most care. She need help, and the biggest care for her is mother, and she need to understand her. She need to listen to her. She's very much aware of her body image. If she has any problems like polycystic ovaries, hirsutism, acne, we should really, really go hard on it, because now she will get the confidence. So women with positive body image are likely to have good mental health. So foundation starts from there. Eating disorders are very common in young age group. So in order for them to look better, and with the recent, media and everything, we need to give them confidence. Societal advice and prescribe my most of the time goes how she's feeling. All premenstrual menstrual problems, their pregnancy, all revolve around who's around them and what they're doing. They need to be taught that how to deal with the ups and downs in the life. Life is really like a boat in a rough sea, and it can't be smooth. So you have, as the tide goes up, we have to go up. As the tide goes down, we have to go down. So we need to learn how to cope with. Problems will come, ups and downs will come in the life. Exercise regularly. So I usually tell them, you don't need to go and hit the gym. Not every woman go and hit the gym. Walking, some yoga, or some exercise, stretching, even stretching, any exercise at home, 10 to 15 minutes you can do anywhere. And self-care. So self-care is a big topic. Uh, and obviously we tell them to take care of them, especially their body, their vitamins. The vitamin D3 is very important, and they should have regular checkups of their health. Consuming balanced diet is also important. I usually advise them about their diet if they are not aware of balanced diet. There's no need to go to nutritionist. There's no need to order the healthy diets. By researching, by finding balanced diet can be managed, and especially we have to pick the women who have metabolic syndromes. For them, there's a special diet, and obviously, if there is no purposeful life, then obviously there is a depression and anxiety. So usually I ask them, what is your plan, what you're going to do in the next 6 months time, anywhere you're traveling, are you working, are you not working? So it's good for them to have, a future plan. So women can be empowered to have more fulfilling and purposeful life and access to the accurate and up-to-date information on most effective strategies of overcoming mental health challenges. So in the end, again, it's the awareness, is the learning them how to have a healthy life, cope with their daily problems. This will sort out this problem. So for for me, the woman is a liberated woman, not in peace. When she's liberated, she's in harmony with her atmosphere, and she has harmony within herself. So there should be harmony outside, the harmony inside. It makes her mentally healthy. Thank you.